I think for any other DHB or any health provider to develop a health literacy action plan, you really need to understand why you want to do this. And of course you want to do it so that your consumers are actually more engaged in their own health, their decision making, in the way they navigate health services. And that's a prime reason, but part of it is quality of service and being able to enable staff to communicate better. This doesn't mean about talking more or doing lots more pamphlets. It's about the quality of the conversation.
The key thing about a plan like this is to make it practical. Start with the willing and the kind of early adopters, if we want to use that sort of language. Identify the longer term systemic issues, but actually they are going to take a long time to address as well. So where are the quick wins? Where's the short-term actions that can be put in place to improve things right now, because that gives a bit of momentum. The other thing is making sure that that plan has got quite tangible timeframes, actions, who's responsible, who's going to do it. It's a bit like any kind of project or service improvement process. If it's clear what's going to happen and when and who's going to do that, then you're much more likely to get some traction on change on the ground.
Understanding your audience, having worked in this organisation for a while, I can appreciate how many staff we have and how busy people are. It is always people's intention to improve what we do for our patients and their whānau. So appreciating that we needed to engage the stakeholders that were involved, we really needed to have a short, sharp engagement, so putting the findings of the report at the beginning of the action plan meant that we could give them the information up front and hopefully use it as a time saver, and then they were able to look further into the report for more information.
Think of something fairly simple that you want to improve, get a team approach to it, involve the patients, and then see where in the chain of that care you give in terms of the information, where you could perhaps improve.
I think the guides that are and the guidance that's been developed by the Ministry are really important and very useful. Very important for people to understand these are tried and true methods, and to take those lessons away. So use the information available, but also really critical for people to think about health literacy reviews as not just about improving services or quality improvement exercise. This is also about actually changing the culture or the way that a team works, to be truly open to the insights that the review offers, and for patients to really benefit from the experiences of the review. Actually teams will change, and you've got to be prepared to change the way you do things, and it is a culture shift.